we are going to hear the benefits of physical therapy and staying active with Dr. Physical Therapy Jennifer Brown. So Dr. Jennifer Brown is a board-certified clinical specialist in geriatrics with a focus on Parkinson's disease inspired by personal family experiences. She founded Dynamic Home Therapy in 2011, offering in-home neurorehabilitation services, and later launched Dynamic NeuroFit in 2021, an outpatient neurorehabilitation and wellness practice in Berwyn, Pennsylvania, including 3 Rocksteady boxing locations for PD group fitness. Dr. Brown is certified in LSVT Big, PWR, which is Parkinson's Wellness Recovery, and Rocksteady Boxing. In 2024, she joined the Rocksteady headquarters, board of directors, and chairs the medical advisory committee. Initiated a Parkinson's support group in 2023 and completed the Parkinson's Foundation's Allied Team Training Program in 2021. Dr. Brown is a recognized speaker for PD events and has earned several awards, including the American Physical Therapy Association's Pennsylvania Private Practice Special Interest Group Award, the Small Business Achievement Award, and the Best Physical Therapy Practice in Chester County in 2022 to 2023.
Thanks, Gabby. And of all days, my allergies are so bad, so forgive me if I have to take a sip of my Starbucks, which I had to have Grubhub order it during the talk. So no, this is really an exciting topic. And you guys were already asking a few questions, you know, when Dr. Feldman was talking a little bit about some of the options and treatments. So I'm excited to go over this with a lot of you. And we'll just be talking about the role of exercise. And then it's PT and OT really, because there is a lot of upper extremity involvement in fine motor coordination. So, you know, as we talked about already, there is involuntary movement and tremor with ET in the hands, but a lot of times too, with some of our clients, we might see it in their head, in their voice and other body parts, which can affect more than just fine motor coordination, as some of you may know who are experiencing it. We know that exercise is medicine, and we also know that a lot of people that we see with ET will have worse tremors after they exercise or when they're fatigued. So then some of our clients will not want to exercise, or the question is, should I be? So we know that the tremor will get a little bit worse after, but then it usually calms down. We also know, as we've heard, that, you know, if you're stressed or anxious, or if you're rushing or you didn't sleep great, that can also make it worse, right? So I always think of the person who is rushing to get to therapy or a doctor's appointment and they didn't sleep great. And then by the time they get there, their tremor might be really worse. So there's a lot of information out there on the web and just in general that yoga, mindfulness, meditation can be very, very helpful in helping to decrease some of those from a physical standpoint that we can help you with. And as Dr. Feldman said, there's no great research that we've found for exercise specific to ET, like there is for Parkinson's. So it's a little tricky, but we do know that exercise helps to improve quality of life because there is a lot of anxiety and depression that can come also. So we do follow, as therapists, the American College of Sports Med, and this is in general exercise recommendations for people. So we follow the same thing, whether it's Parkinson's or ET. So thinking about 150 minutes of cardiac exercise or cardio aerobic exercise per week. And I will have people think that that is so long, but out of the whole week, it's 2.5 hours out of your week. And you can split it up throughout the week. They're not saying all in one day. In fact, it's better to spread it out. And they are recommending moderate intensity, which unfortunately, a lot of my clients ask if that counts walking to the mailbox or taking their dog out, and it does not. So it has to get you working where you feel like you're working, right? You can still talk, but maybe you're breathing a little bit heavier. And it just gives some examples, you know, so if you're really cleaning and getting your heart rate up, if you're doing gardening, if you're going for a brisk walk around the neighborhood, certain yoga. Now, if you're doing more of a relaxation yoga for the the anxiety piece, that's a little different than a more intense flow yoga where you're getting your heart rate up. Also, the other option is vigorous 75 minutes if you're not doing moderate. But again, any is better than none. So with the vigorous, you're having trouble. So you might be walking up a hill or hiking or doing things that are really getting your heart rate up where it is more challenging to breathe. With all of these, though, you wouldn't just run out and do this, right? Because some of us out there may have cardiac history, right? So doing that that initial evaluation first with a therapist is really, really critical because we will assess your vitals, we go over your medical history, and it really is more individualized versus just saying, go do all of this, okay? Plus, you might have other issues going on. The other recommendation is for strength training. So resistance training for all the major muscle groups, 2 or more days a week, but with a day in between at least, right? So a lot of times you might be doing a cardio workout that's including, light dumbbells, something like that. So it can be body weight, it can be the bands as you see. The person in the middle is also working on balance by sitting on the ball, so that's extra bonus points. But these are things that we can help you with, or if you take exercise classes at a gym, they might be covering more than one area at a time. And then the last recommendation is flexibility and neuromotor exercise, which is balance. So thinking about if you are taking a yoga class, and this is 2 to 3 times per week. Now, a lot of people get worried and they think, well, if I'm doing weights twice a week and this 2 to 3 times a week, and then the cardio, it's going to be every day and there's not going to be any downtime. So it can be combined. And a lot of exercises are multimodal, which means we combine them. So you're working on more than one thing at the same time. But it really, really is helpful. And even though potentially tremor might just be in your hands, maybe then you're not moving as much. Maybe the balance is also a little bit off. So there's a lot of different areas that we want to look at and assess and work with you on. And to get you on a program because you may not know what that looks like for you. The other part that we look at is just as if we're talking here with the movement disorder specialist and the neurosurgeons and the neurologists that see more of the essential tremor and Parkinson's types of diagnoses, there are certain therapists that also specialize more in these areas versus a general therapist. Ideally, that would be your best bet because they see more people with these diagnoses. But as therapists, we would assess areas that are challenging to you because they may not be challenging to the next person. Making recommendations for any adaptive equipment or maybe modifications or techniques that we have to train you or teach you in, setting up that program. Like we said, it can't be a cookie cutter. It's very individualized. And then looking at other issues, right? A lot of people, we have as we get older, orthopedic issues, there might be osteopenia or osteoporosis, cardiovascular. And with the tremor, we see a lot of clients with hands who are aging where there might also be arthritis that can be adding to some issues with their hand control. So there's a lot of things that we're looking at with that too. And then just as we said, balance, walking, mobility, the sleep hygiene is something that is covered under occupational therapy through their plan of care that a lot of our OTs will work with clients on how to sleep better, get more into a routine, help with that relaxation piece so that you're feeling better the next day. And then again, like leisure activities, what do you like to do? What are you not doing maybe because you might be embarrassed to go out in the public, or a lot of our folks don't want to go to parties or restaurants because eating might be challenging with their tremor. So really thinking about things we can help improve the quality of life. And then again, just as was said in the last few talks, we work closely with the team for people either pre or post DBS or the focus ultrasound. If there's not a nurse needed, we'll usually go out to see the folks who are getting the focus ultrasound within that 24 hours just to, if we have to make any changes or for safety those first couple days too. But again, working with your doctors and the surgeons. Okay. And then addressing the challenges with ADLs and IADL. So this is really more to give you an idea of just some things. Again, this isn't for everyone because everyone may have different issues, but fine motor coordination. And again, it's not necessarily that the hands are getting weaker, the coordination is off from the tremor. So the further your arm is away from your body, the worse the tremor will get. So a lot of the tricks that we teach are keeping your arms closer to your body or your body closer to the table or where you might be working if that's an issue. But handwriting, there's weighted pens, there's the cuff Velcro weights around the wrist, leaning on the table, writing smaller versus really bigger can help because it keeps the tremor at bay sometimes. With dressing, there's a lot of companies out there now, and on Amazon, if you look, the magnetic clothing, the magnetic closures, they are really nice and they look just as regular clothes you would never know. So instead of having to work the buttons or zippers, things like that, some of the new sneakers out there, a lot of our clients use the Kizik's where you just slip your foot in. You don't have to worry about pulling the back up. Some of them, then you don't even have to tie the laces. It just makes life a little bit easier. On the computer, that seems to be a big issue too for our clients. So there's different mouses, there's speech recognition. In your accessibility features, you can set that up, and OT works on all of this with you. Same with the phones. A lot of the phones now, which is really nice, on the cell phone, you can talk to text, you can record yourself giving a note. There's larger phones. If you still have a landline phone, they have ones with much larger buttons, so they're easier to work. And a lot of people wear, the Bluetooth speakers in their ears, the AirPods, things like that. So you don't have to worry about touching the phone and working things during the conversations. The other thing I just put here is the SteadyWear glove, and I'm not sure if you guys are familiar with it. We have a couple of trials that we use with clients. It's a glove, it's weighted, there's a magnet, and it's supposed to counterbalance some of the tremor when you're working. For some of our clients, it works really well. For some of them, it doesn't. It's not covered under insurance. If you're through the VA, there's sometimes coverage. And the one thing is that for some people, they'd rather have the tremor than wear this big bulky thing on their hands when they're out. But if you're home and it helps, that's definitely one option. Jewelry, makeup, there are magnetic attachments on Amazon for necklaces, for earrings to make life easier. Cutting the food, and you'll see on the right for eating and cutting, that seems to be a big area. There are, as many of you may have tried, weighted utensils or those foam things on the right that you can see that you can build up things that you're working on. So it's a bigger grip. As far as eating goes, plastic is better than glass, obviously, if possible. But there's also built up bowls and plates that have an edge around it so that if you're eating and you're starting to have more tremor, it won't push the food off your plate. There's so many things out there, and that's where OT can really play a role because they know all of the different types of equipment and they can trial it with you. We tell people never waste your money if you don't have to. Make sure it's going to work for you first. And then on the bottom right, you'll see that spoon. It's the liftware utensil. And if anyone has tried that, it's on Amazon also. It's about $200 for the starter spoon. But when you start to move, it offsets the tremor so that it holds the spoon a little bit more steadier, so it won't shake as much. For shaving, brushing teeth, electric is much better for both. There's little tricks, putting your toothpaste on the counter and then just using your hand to squeeze it onto the toothbrush. So lots of little tricks that you can do that you can work on. And that's why a lot of times OT might be better in the home. You don't have to be homebound. There's different types of insurance coverage. So that's something to consider also. But these are other little things that you may work on. That test on the left, some of you may have taken, it's the 9-hole peg test. And we will do that a lot to get a baseline and then work on coordination. You have to put the pegs in the holes, looking at both hands. And then these are just some of the toys that we use that we might work with you or have you do as a home program to fine tune some of the the coordination, and some of you that might need the strength training with it. And then on the right, I put that there. That is a U-step walker. So for some people that we see with tremor who are having a lot of balance issues, if you use a regular walker, it could shake side to side and be really unsteady and maybe a higher fall risk. The U-step walker is used for people with neurological conditions, but it's really steady. It's a steady frame. It's really hard to tip over. And it is covered under insurance if you don't have another device in the past 5 years. So that's something that we trial at our clinic with a lot of folks. We could take it to the home and see, but it's just another piece out there that's a little bit safer, but it's really tricky to manage taking out in the community because it's so heavy and it is a flat frame. It doesn't fold up like a regular walker. So just things to consider. And then the other thing is thinking about group functional fitness, right? So for some folks, like I know like myself, if I were to sit home, I would never work out, even though I'm a PT. I need some kind of motivation. So being out and about, going to a group class, you socialize, you're practicing different moves. You're practicing a lot of floor activity also for some of the classes, which is really important if balance is an issue. Also, just the music, it helps with anxiety, feeling better, you're laughing, and being around people is always more motivating because you're going to push yourself harder, right? So for some tips and takeaways with this, obviously you would check with your doctor before starting to exercise if it's new to you. In most cases, if you're doing therapy, we would ask that you're going to get a prescription for PT or OT. Generally, we're going to go through a neurologist if we're seeing someone for the essential tremor. And again, trying to find someone that has some experience in movement disorder. It is tricky because if you call any of the local places, they might say, oh yeah, we've worked with someone, but you can ask like how often, right? Maybe it's one person a year, two people a year versus someone that's seeing that on a daily basis. There is for those of you that know or have heard of LSVT Big, that's a program specific for Parkinson's and movement disorders, but they do have a national website, and most of those therapists who are on there have more experience than others. And finding something that you're going to like, right? So if you're someone that needs a group, find a friend that will walk with you, find someone else who might be motivating, and make sure it's something that you like. I had a patient that hated yoga, but yet she went because everyone was telling her it would be good for her anxiety, but she hated it. So, we have to find something that she would like to do, and it ends up that she really enjoyed gardening more, and it brought her joy to be outside. So just kind of thinking about that. And then the parts of the exercise program that we're looking at. The other thing I always throw in there is if you are doing a new type of exercise or a new skill, that has added benefits. I heard, a couple of people asked about dementia, things like that. As we get older, the brain can do amazing things, as many of you have probably heard of neuroplasticity. So we're always trying to add a dual tasking or something that's going to work the brain with the body. That's always more beneficial. But first, we just need to get your body to move. And since the pandemic, there are a lot more of opportunities for exercise, not just in person, but also virtually. So again, it depends on what you need to motivate you and how you respond, but there are a lot of options out there. So again, working with your whole team, advocating for yourself, and your doctor may not even be ordering therapy, or if you're going to your primary care and you've had essential tremor for years, we see a lot of people that say, oh, I had therapy like 15 years ago and nothing really changed. Well, in 15 years, it may have changed that maybe you have new symptoms. So you need to be reassessed. You need a tune-up. And some people will get a tune-up, like once a year, where insurance will pay for that evaluation to relook at your program, modify things, see if anything has changed, and then just really trying to stay active as best as you can. And that is it. If anyone has any questions.
It looks like someone had mentioned that desk ellipticals were really great for working with balance and safe, but get them sweating.
An elliptical?
Yeah, the desk ellipticals.
Oh, yeah. Hey, if that's going to work for you, now the ellipticals that you're standing at and working your arms and getting more, obviously that'll get you up cardio more. Um, but absolutely, there's one called the QB. I think it's CUBI, and we use those a lot with folks at home so that it just gives you something to work on and move. It's better than doing nothing. And if that's what you're going to do, we love it.
Is physical therapy covered by insurance, typically
Yes.
Medicare, ARP, if you know?
Yes, yes. So Medicare, so it depends, and this is where you kind of have to advocate and and if you're working or talking to Denise, she can help too when she's ordering it. If you need a nurse and you're homebound, meaning it's really challenging to get out of the house, then that is under Medicare Part A. And that is covered, but that means there's therapy and a nurse, sometimes a social worker, sometimes an aide a couple times a week if needed, if it was post-surgery. Medicare Part B is your outpatient, right? So that's what pays to see one of your neurologist if you go to the office, or blood work, or outpatient physical or occupational or speech therapy. Medicare covers the first 80% if it's Part B. And if you have a secondary insurance, usually that covers the other 20%. AARP does. But be aware, if you have a Medicare Advantage plan, they don't have the same rules as Medicare sometimes, even though they may say that they do. So you might be limited or capitated somewhere that you can go, and you may have more out of pocket depending. But with Medicare Part B, you don't have to be homebound, but you can get it in a clinic if you live in an assisted living or if you are at home. So it's outpatient at home. And that's what our model was initially. So it's definitely available. People don't know about it, and people think that they have to have something major happen to them to qualify for therapy, like a fall. So we want to see you before the fall so we can help guide you, right? And prevent that. But generally it is speaking to your doctor to get the prescription and going from there.
Andrea put, for anyone who may not have seen them, she put a couple links in the chat for assistive devices, and it looks like lending libraries where you could try out the devices before you buy them, just in case if anyone's interested. There was one other question. Someone had said they just completed physical therapy and their essential tremor increased with upper extremity strengthening. Any suggestions?
So I haven't heard of it increasing with the strengthening. I'm wondering if it's increasing on the days of therapy or if you're working too hard. Sometimes what we'll say is to kind of spread it out, right? So if you know that you're going to therapy, or if you have something big that day, don't overdo it right before. Kind of save your energy, and energy conservation is what the OTs will call it, and spreading out and helping you with a routine or your schedule during the day. Generally speaking, what we see is it can get worse right after the exercise, just because your heart rate's up, you're working harder, it can increase, but then usually it dissipates, soon after they're home or done. I haven't heard of it getting worse over time just from strengthening.
Okay, I think that was all the questions here in the chat. Thank you, Dr. Brown.
Thank you.